Hello and welcome to Savvy Survivor. Meredith Mendelson here, co-founder. We're the place for inspiration and information for those who've completed their cancer treatment and are living with cancer, as well as their providers and caregivers. Today our guest is Elly Cohen, who's an assistant professor of surgery at the University of California in San Francisco and the program manager for breastcancertrials.org. Welcome, Elly. Please tell us about yourself and your connection to survivorship.
Thank you, Meredith. I'm delighted to be here. So I am the program director of breastcancertrials.org, which is a resource for helping patients engage in clinical research. And I'll describe that a little bit more as we go on with the conversation. But my also connection is I am a survivor. I'm a 20-year survivor of breast cancer. I was diagnosed in my 40s. I had surgery, chemotherapy, and 10 rounds of hormone therapy. So I've been through the whole gamut of the breast cancer journey. Currently, I have no evidence of disease, but I'm also very experienced about metastatic breast cancer. I'm the daughter of a mother who died of metastatic breast cancer. So I've seen it from all the total surround.
And tell us about the work that you do and how it applies to cancer survivors.
So the difference in my survival, living 20 years with after the diagnosis of breast cancer, and my mother who died in 1978, having lived with breast cancer only for 4 years, really has to do so much with the clinical research that went on between her diagnosis and my diagnosis. Between that time, adjuvant hormone therapy, adjuvant chemotherapy, which were not available to her, became available and tested to be safe and effective in people with breast cancer. And I had all of those therapies, which helped to sort of prevent a recurrence of my breast cancer. So I believe very, very strongly in the role of clinical research in advancing breast cancer care, particularly now that we have just accelerated our knowledge of how the cell works, how cancer cells continue to proliferate and divide. So there's a lot of research, but those medications really need to be tested in clinical trials before they can be provided to the public, the general public. So clinical trials are incredibly important in terms of advancing care from the medical point of view, but they're also important in terms of quality of life. And I think this is where it's really important for cancer survivorships to understand how they can participate in research. Our tools and services make it easy for patients and survivors to find trials for which they're potentially eligible, as well as what we call observational studies, which are not a clinical trial, but which patients can work with researchers who are collecting information about their cancer experience and analyzing that information to create hypotheses to improve care.
Great. Thank you for that description. And it sounds like there are opportunities for people who've completed their treatment or are living with metastatic disease to participate in these research studies. Is that right?
Absolutely. So let me go back to my experience again. I participated in a support group trial when I completed my treatment. And I was looking for sort of drop-in support groups and didn't find any locally that I felt really comfortable. And it turned out at that time, the University of California, San Francisco was conducting a support group for post-treatment survivors, looking at comparing a just traditional support group with a support group that incorporated services such as programs such as yoga, art therapy, and so forth, to see if that made a difference on any of the outcome measures that they were evaluating in terms of survivorship. And it was an 8-week study. I was randomized to what was called the control group, so I was in a traditional support group, but it was truly a wonderful, wonderful experience. So again, for post-treatment survivors who've completed treatment, There are opportunities to participate in support groups such as I described, mindfulness, yoga, different ways to alleviate, the isolation or stress of dealing with recurrences. There are also trials dealing with symptom management. So for those who might be experiencing or continue to experience neuropathies, if they've had taxanes, or in some cases, the neuralgias and discomfort that are associated with aromatase inhibitors, there are still opportunities for survivors. Again, here I'm talking about post-treatment survivors to participate in those kinds of studies. And for metastatic patients who are in treatment or looking for a new treatment, there are opportunities from our services to find trials for which they're potentially eligible. If they're interested in looking for a treatment trial as part of their considerations for treatment, as well, again, for these quality of life studies, which are very, very important in alleviating the stress and anxiety of living with metastatic breast cancer.
Can you tell us more about how your system works?
Sure. We have two applications. One is breastcancertrials.org, which is for all patients who, no matter where they are on their cancer journey. And as I said before, there's opportunities to participate in research across the cancer journey. If you are a post-treatment survivor, then I recommend you going to breastcancertrials.org. And we have a number of trials that are available for post-treatment survivors. And you can either match to those trials. We have a profile that you can create for yourself, and it's customized for post-treatment survivors. And we also have a variety of filters that you can use if you don't want to go through the matching system. We have over 600 trials in our registry, and among the filters is we have trials that we have identified as using complementary and alternative medicine in terms of the things that they're looking for. Or another area we have is something called no travel required. I call that armchair research. I think that's really important and an easy way for patients to engage in research. Generally, it's a telephone survey or an online survey. The research may ask the patients to provide a swab or a saliva sample so they have some more information about your tumor. But that's for post-treatment survivors. People have had early-stage breast cancer and have completed their treatment. I would recommend going to breastcancertrials.org, sort of our legacy application. For metastatic patients, we have created an application specifically for them called Metastatic Trial Search. And let me, Meredith, if I can just share my screen.
Yes, please do.
Okay. So Metastatic Trial Search creates, and breastcancertrials.org not only makes it easy for patients to find trials, but it also provides the information about trials in very patient-friendly language. We write the information about the trials, our staff does, and because we want to make it comfortable for patients to talk to their doctors about trials, as opposed to going to some of the government resources which can overwhelm you with information. So here is a search that I did for a patient who has triple-negative breast cancer, who has metastasis to the liver, and that patient has matched to a variety of trials, but I've narrowed those down to look at trials for complementary and alternative medicine, as what I call no travel required. So here's one looking at using mindfulness to reduce stress. Here are some as a observational study. This is the Health of Women study that's run by the Susan Love Foundation. And again, this one, anybody with breast cancer can participate. The Susan Love Foundation is looking to try and understand what's the cancer experience, what kind of exposures you've had in your life that may have contributed to your getting breast cancer. So they're collecting a lot of information about that. Here's one about a telephone support system to reduce fatigue from metastatic breast cancer. And here's another one that I really like. It's the Cancer Support Community's Cancer Experience Registry. And even though this is on Metastatic Trial Search, it's also on breastcancertrials.org because it's available for all patients. This, again, is an observational study. It's not a clinical trial. It's armchair research. And what the Cancer Support Community is interested is the psychosocial experience of living with breast cancer. How can they learn from patients who have been coping with breast cancer to make recommendations to patients about how to engage in these successful coping mechanisms? It's been around for a very, very long time, and it's a very, very rich data set.
Wow. And it looks like this tool has done, and you and your group have done a lot of the legwork that, you know, those of us on the other side of the computer screen might not have the knowledge or access to.
Right.
Yeah.
Yeah. You know, the basic premise is that whether you're looking for a treatment trial or you're looking for ways to engage in research, we really believe as a call to action that breast cancer patients should engage in research, either as to consider it as an option for care if they're at treatment decision, or if they're on if they have metastatic breast cancer and they're stable, to look at what options are available for them if they should recur, and also to participate in any kind of study that furthers care, even observational studies.
Well, this is terrific information. Thank you so much for sharing this with us today, Elly.
You're welcome.
We'll be sure to include resources with this, along with this video, for the things that you told us about today, as well as other clinical trials matching services.
Okay. Thank you, Meredith.
Thank you.